So I just want to stress here that you don't have to wait for a symptom to go and have a mammogram, because that is not a screening mammogram. Screening tests are done when you feel absolutely healthy, because that is when we will pick up the tiniest lesions that are developing.
So today we have with us Dr. Kanchan Kaur. She is Director of Breast Surgery from Medanta Hospital. Thank you, Dr. Kaur, for joining us on this call here.
Thank you so much for having me on.
So one of the first questions is, can cancer be detected early?
So yes, Payal, the whole idea of screening, the word screening basically means that we want to pick cancers before they become evident. And luckily, for the two commonest cancers amongst women, which is breast and cervical cancer, screening tests are very simple, and it is very easy for us to detect cancers even in stage 0, sometimes even in precancerous stages. So yes, screening is possible, and especially for breast and cervix, as I mentioned, because these are common cancers, women should seek out the tests at the required intervals after discussing with their specialists and get them done.
Okay, thank you. The second question is, what are the cancer screening options for women?
Start with breast first. So formal screening, which means an x-ray of the breast, which we call a mammogram, starts at anywhere between age 40 and 50. In India, because cancers happen a decade earlier than they happen in the West, so we do recommend that women should start off their screening mammograms at the age of 40. So I just want to stress here that you don't have to wait for a symptom to go and have a mammogram, because that is not a screening mammogram. Screening tests are done when you feel absolutely healthy, because that is when we will pick up the tiniest lesions that are developing. So screening mammogram starting at age 40. Even as experts, we will never agree to what is the best time interval. So it's either every year or once every 2 years. It's best to discuss this with your oncologist or your gynecologist and decide, whether you should be having them yearly or once every 2 years. And till you reach the age of 40 doesn't mean that you don't have to do anything. So although there is no formal screening under the age of 40, I do want to stress here, and I really wish that women would pass this message along, that girls as young as 16, 17, 18, when their breasts develop, should learn how to self-examine their breasts, because self-examination of the breast allows us to pick up cancers at a very early stage, especially in this age group from 25 to 40, when we are not doing mammograms as a routine. So self-breast examination once a month, every month, irrespective, is a good screening tool. Mammograms from the age of 40 onwards. For cervical cancers, pap smears are recommended from the age of 26 onwards, and 21, 26, and they are done once every 3 years. And if you get the HPV DNA testing done, which means that when they do your pap smear, they look for the viral DNA that is known to cause cervical cancer. If that is normal, then once every 5 years.
All right. So I had the question about which age to begin with, which you've already answered. So I'll slightly modify my last question here. Do women with bulkier breasts, should they begin their mammography before the age 40?
No, it's got nothing to do with the size of the breast. The only thing is that there is something called a dense breast. Dense breast means that on the mammogram, the breast looks very white, and cancers also look white, and milk glands also look white. So in women who have dense breasts, the chances of us missing something on a mammogram is slightly higher. That is why women who have dense breasts should be offered ultrasound examination along with the mammogram. And here, I just want to quickly put in a bit of information that for any lump that is detected in the breast, so yes, we are talking of screening, but I do want people to know that if you have a problem in the the breast, please make sure that you undergo what is called triple assessment. Triple assessment means that the first thing should always be the checkup by a doctor who physically examines you. The second is to get a mammogram and or an ultrasound and or an MRI. And the third is to do a needle biopsy to confirm the diagnosis.
Just the last bit for this Women's Day, any message for us women?
Oh, I would have so many messages to give. I think it is so important for us women to understand that, it's not just this one day that we should realize what beautiful piece of nature we are, how we multitask, how we look after the entire world. And I think the biggest message that I want to give, I can written behind you. I know that's for screening purpose, but I think when in the context of women, yes, I can look after myself also. I think if we complete the sentence, because we will always put off our health for weird and wonderful reasons to do with family and kids and career. But remember, your health comes first. I remember I was talking at a Women's Day event somewhere, and a lady got up and said, I feel very sad when, I don't get flowers on Valentine's Day or my anniversary. So, I told her one thing, and I want to say this to all women. If you feel like getting flowers, don't wait for somebody to get them for you. Get them for yourselves. Do what makes you happy. And if you are happy, your family is happy and satisfied. So that's really, really important. Please look after yourselves. The health of your family depends first on your health. If you are not looking after your health, it completely, everything just comes crumbling down.
Perfect. It's such a beautiful note to end with. Thank you so much, Dr. Kaur, once again for joining us and sharing these
So much,
pearls of
Asha.
wisdom.